My dear followers, today I am in front of you with the subject supraventricular tachycardia. You see the ECG of my patient. Patient was a female patient. She came to me with palpitation and shortness of breath. I done an ECG. ECG shows narrow complex with regular tachycardia. Heart rate was 229 beats per minute. I treated her with betablocker. She is okay. Now, what is supraventricular tachycardia? When there is regular tachycardia on ECG and narrow QRS complex, it is called supraventricular tachycardia. Here, upper chamber of heart beat rapidly. Patient may present with palpitation, shortness of breath, chest pain, dizziness or lightheadedness, polyuria, etc. Causes are heart disease, heart failure, lot of caffeine use, excess amount of alcohol, smoking, pregnancy, some drugs like asthma medication. Treatment is done with cardioversion or drug. You should assess hemodynamic status. If patient is hemodynamically unstable, then synchronized cardioversion should be given. When patient is hemodynamically stable, then carotid masses and some drugs can be used like betablocker, adenosine. Thank you very much. If you don't subscribe my channel yet, please subscribe my channel to get a new video from me later. Thank you very much.